The tonsils are there to help fight germs that come in through our mouth or nose before they cause infections in the rest of the body. Usually, tonsils do their job well. But sometimes bacteria or viruses get into the tonsils and infect them. When this happens, you have tonsillitis.
If you look at it in children, about 30 to 40% of children will suffer from tonsillitis at some stage during their childhood. It's most common under the age of 15 and less so as we get older as adults.
Tonsillitis is usually accompanied by fever, pain when swallowing, and white patches on top of red swollen tonsils. It can be viral or bacterial.
In terms of viral infections, we're talking about things like influenza and parainfluenza virus, a common flu. But the really bad sore throats or tonsillitis are usually caused by bacteria, in particular the group A beta hemolytic strep. We call it strep throat. And that one is usually particularly bad.
Dr. Smith says the treatment depends on what causes the tonsillitis in the first place.
So most commonly the treatment options would include relief of pain, and that can be done using lozenges, those sweets that you suck to soothe your throat. We can use anti-inflammatory medications, diclofenac, Voltaren, Cataflam, those kinds of things, or even Panadol, acetaminophen. And in addition to that, if we think it's truly a bacterial infection, then usually antibiotics are given.
However, after more than 7 episodes for the year, persons will have to do surgery to remove the tonsils.
The issue with immunization, though, is that it doesn't prevent all cases of tonsillitis. One other thing that one can do is whenever you come in contact with people who have sore throats, you don't, share utensils or kiss in order to spread the infection. Even methods such as hand washing are important in avoiding the spread of tonsillitis.
With our health report, I'm Shamela Mitchell wishing you good health. Health report.